Hi, my name is John Hammond. I'm a second-year pediatric nephrology fellow at Johns Hopkins Children's Center. I'm also a master's student at the Johns Hopkins Bloomberg School of Public Health. And I presented at the Pediatric Academic Societies Meeting on a project entitled Interval Healthcare Provider Contact and Blood Pressure Control in Children with Chronic Kidney Disease and Hypertension. The impetus for this project was really something that myself and that Dr. Brady, one of the attending nephrologists here at Hopkins, something that we were seeing in our clinical practice. And that was that, even in our kids with chronic kidney disease, blood pressure remains poorly controlled. We also know from the literature that blood pressure control is really suboptimal in the general pediatric population as well. This trend persists despite the fact that we know that hypertension is associated with cardiovascular comorbidities. And also in kids with chronic kidney disease, hypertension is associated with more accelerated progression of their underlying kidney disease. Great things about working at Hopkins is that you have access to experts across the university. Dr. Derek Eng works at the School of Public Health and is a principal investigator at the Data Coordinating Center for the Chronic Kidney Disease in Children cohort, which is this large cohort in which I think 1,100 kids are enrolled from over 50 sites across the country, and is really an invaluable resource for data in the pediatric chronic kidney disease population. And luckily for us, this cohort collects data or has collected data both about frequency of healthcare provider contact over the prior year, and also measures annual blood pressures. And so the data was there to answer one of the targets that we identified for better controlling blood pressure, which is just to see if we saw children more frequently, if those increased encounters would allow for better blood pressure control. And what we ultimately found was that kids with chronic kidney disease and underlying hypertension who saw a healthcare provider 3 to 5 times over the prior year were more likely to have their blood pressure controlled compared to kids who didn't see a healthcare provider at all over the prior year, which in the end hopefully helps us identify another target and another potential intervention for controlling blood pressure in the pediatric chronic kidney disease population. Thank you for listening to my presentation.